Driving under the influence of prescription and OTC drugs, Part 4. Let's look at some common over-the-counter drugs' probable side effects. Pain relievers. Aspirin, Tylenol, and Advil are examples of low-strength painkillers that can be acquired without a prescription. These medications can ease the discomfort brought on by headaches, muscle pains, dental issues, and minor joint pain. Additionally, they can be used to lower fever in persons with the flu and other viral diseases. OTC painkillers are generally harmless, but they can be dangerous if used excessively or for a long time. Blood thinning, an increased risk of heart disease, heart attack, and stroke, liver damage, stomach lining degradation, and light sensitivity are some of the long-term health hazards connected with these medications. Any pain reliever that has a suggested dosage might be lethal if taken in excess. While significant negative side effects from over-the-counter painkillers are uncommon, mild negative side effects are rather prevalent and can easily impair your ability to drive. Adverse effects of over-the-counter painkillers include drowsiness, headaches, stomach pain, nausea, vision problems. Any unpleasant side effects would make it harder for you to fully focus on the driving activity and would raise the likelihood that you would crash your car. Before getting behind the wheel, always wait for painkillers to take effect to ensure that they won't impair your ability to drive safely. Antihistamines. Antihistamines are a class of histamine-blocking medication that reduces the inflammatory reaction of your body to allergens like pollen, pet hair, and dust. They can be used to treat cold and flu symptoms due to their anti-inflammatory properties. Several well-known OTC antihistamines include Vanafen, Silidril, Benadryl, Unisom, and Ploretrimeton. If you need to drive or handle heavy machinery, you should use antihistamines cautiously because many of them have a strong sedative effect. Additional negative effects include muscle tremor, anxiety or jitters, dizziness, nausea, restlessness, vision problems, in severe cases. Antihistamines can have physical and mental side effects, so it's crucial to know how you'll feel before deciding to drive while taking them. The most frequent adverse effects include restlessness, anxiety, and anxiousness. These impacts may influence how you make judgments while driving, make you more impatient, and make you more likely to drive aggressively even in circumstances that are mild enough not to be immediately visible. Keep in mind that antihistamines frequently make other medicines and substances, such as alcohol, more powerful. When using antihistamines and even a modest amount of alcohol, you can find yourself suddenly becoming severely impaired. Cough syrup. The majority of over-the-counter cough medications, including Robitussin and Nyquil, include the hallucinogenic substance dextromethorphan as its active component. When consumed, it produces a comparable chemical response to PCP. There is hardly any of this medication in over-the-counter cough medications. Without producing unfavorable side effects, it is sufficient to produce positive expectorant and cough-relieving benefits. The amount of dextromethorphan you consume may rise if you take any cough treatment in excess of the authorized dosage, which could have adverse effects. For example, dextromethorphan has been linked to hallucinations, focus deficit, seizures, a fictitious sense of security, violent conduct. Driving while experiencing any of these conditions might result in very risky conduct. Remember that dextromethorphan and alcohol together have a stronger effect. When taking over-the-counter cough medications, never consume alcohol and always take the prescribed dosage. Before starting any travel while taking a prescription that contains dextromethorphan, be sure you are both physically and emotionally prepared to drive. Risks associated with medication interactions. All drugs, prescription, over-the-counter, and illicit, have a chemical reaction in the body that causes both mental and physical effects. A person taking 2 or more medications at once may have drug interactions, which could result in a different chemical reaction and thus, different outcomes. It's crucial to remember that just because a drug often doesn't make you unable to drive, doesn't guarantee it will be similarly safe when used alongside another medication. Before taking 2 medications at the same time, always with your doctor or pharmacist. Combining drugs can have major negative effects on your health in addition to making it risky for you to drive.